I'm David Lombardo, and you're listening to WCNY's The Capitol Press Room, and we're joined by Assemblymember Al Sturpey, a Syracuse area Democrat, who's here to discuss the issue of prompt payment to healthcare providers from health insurance companies. Thanks for visiting us in the studio, Assemblymember.
Thanks for having me. This is like my second office now, twice in 2 weeks.
We're hoping to get you that co-host duty eventually. Well, turning to your legislation here, you're looking to address what healthcare providers like hospitals see as a real problem, and that's the timeliness of their payments from health insurers. So what is it about the status quo that is a problem from their perspective?
Well, the issue is, first of all, after everything's said and done through the process that exists now, 98% of the invoices turned in get paid. So unfortunately, the insurance companies are not paying. It's one thing after another that they say, no, we need this, now we need this, now we need this. And they keep putting obstacles in the way. And there are hundreds of millions of dollars that are owed to these hospitals that are out, I'd say, 180 days or more. Some of them are a year old. And it just doesn't seem to make sense that you would delay so much when you can only find 2% of all the invoices that you're not going to pay. So we're saying, and first of all, hospitals, and we know this, are in desperate need of money. The rates that they get reimbursed aren't high enough to cover their costs in a lot of cases. I mean, they have to increase the cost to people who have insurance in order to cover the Medicaid, services they provide and everything. So it's kind of a mess. This is one thing we could do for them that's not going to cost the state billions of dollars, and it's not really going to hurt the insurance companies because they're going to pay it anyway. It just makes for timely payments so the hospital's cash flow is better.
So is it that simple that your bill essentially just says you provide a service, you get paid for it, and then after the fact, if you can detect some sort of issue, the hospital is going to be on the hook for repaying it?
That's right. You audit on the back end. If you say there's a document missing, you request a document. If it doesn't come in a required period of time, you can say, okay, we're going to deduct this over the next payment. So, I mean, the insurance company is protected because healthcare continues on over and over every month. So there's always going to be a payment coming out. And if you're owed some money, you just take it out of that payment.
Is there an expectation, though, that if you do flip things, that you're going to see the same problem, but in reverse? Insurance companies will now be waiting and waiting and waiting to get money back, and they're going to have their own cash flow problems.
Well, I'm sure if anything like that actually happened, the army of lobbyists that insurance companies have would descend on Albany, and everybody would know about this terrible problem, and we'd be doing legislation to correct that. I don't really see that happening, but, you never know. We're always on the lookout for things like that.
And luckily, the hospitals have their fair share of
They've
representatives in the halls.
They've got a few, yes.
So do you think the status quo represents the system not working, or that it's working as it is intended to work, that it is supposed to be this very rigorous check to make sure that money is only going where it needs to go?
Well, I don't think when someone devised the system in the beginning, they thought that hospitals would have to have a full army of people who are just going and providing paperwork to insurance companies. They were hoping they could provide more payroll for actual healthcare workers than administration, but that's what it's turned into. Way too much administration, way too much delay, and the healthcare system in this country is not in great shape. The changes the federal government is making makes it even worse. I don't know what's going to happen in the future, but right now this is one thing I know we could do to help hospitals provide better service for constituents.
Well, before we move on, let me reintroduce you. For listeners just joining us, I'm David Lombardo, and this is WCNY's The Capitol Press Room, and we're speaking with Assemblymember Al Sturpey, a Syracuse area Democrat who chairs his chamber's Committee on Economic Development, Job Creation, Commerce, and Industry. Well, in terms of the rationale for this, one of the problems cited in your bill memorandum is this idea of health insurers doing blanket denials as sort of just a knee-jerk reaction to any sort of claim by a hospital or healthcare provider to get paid. As opposed to reversing the whole model, why not address whatever incentives there are to do that de facto rejection? Why not increase, say, civil penalties for bad faith rejection, so that way you can keep the existing model, but maybe make it flow a little bit better?
Well, I don't know that that would really change things that much.
Not if you put enough zeros on the end of that penalty?
And then they appeal it, and it goes on and on
Sure.
forever. I'm not sure, and I don't know that the Codes Committee has the appetite for throwing out a whole bunch of extra penalties. It gets pretty messy when you do it that way.
Mm-hmm.
I would rather go ahead, provide the service in a reasonable amount of time, which is, I don't know, 30 days you get paid, and, then go ahead and find out if there's a problem. I'm sure that if that went into effect, the insurance companies wouldn't be calling and complaining all the time about this document or that document, because they pretty much would know if that's a service
Sure.
that's covered under their insurance policy. They just don't get to delay things anymore by asking for another document. And they can save money on their end in administration, too.
Well, I'm glad you bring up the Codes Committee in the Assembly, because it makes me think of the broader challenge of moving a healthcare bill right now, because this is a very complicated model, and here you're talking about pulling at one string of the healthcare system. And given that, do you think that this is something that can be tackled as a standalone bill? Obviously, you have it as a standalone bill, but would it be better as part of some sort of comprehensive overhaul where here the hospitals are getting something, but maybe you also throw the health insurance companies a bone by doing something like capping what hospitals can charge for services that are essentially things that could be provided in a doctor's office? I mean, do you think about taking this on more holistically to improve its chances?
It would be great if we could take a holistic approach to healthcare in the United States. I think the problem trying to do it in New York State, you're talking about New York healthcare bill, changing completely the way we do healthcare. Having healthcare as a profit-driven industry.
Oh, I'm just saying there's a bill that just caps it, like those types of services, at 150% of the Medicare rate. That's like a bill unions are pushing. So I'm just saying, kind of use the downtime you have as you're waiting for the budget to get passed, and open this up and say, hey, everybody, what sort of tweaks or changes would you like? Let's take a broader look at something like this.
Most insurance companies, as far as what they're going to pay hospitals, already have some rates that they've set.
Sure.
And that's all they're going to get. I mean, I had eye surgery. I looked at the bill. It's $65,000.
Are you sure the surgery wasn't bad? Maybe it really said $65?
No, it said $65,000.
Okay.
But I think what they got paid out of all of that is about $15,000.
Sure.
So, there's already some safeguards set in there for how much can be charged for different kinds of procedures. And we know that, Medicaid doesn't pay close to what it costs. So, I'm up for anything. If you come up with a nice bill, I'm willing to put it in.
And we'll have more with Assemblymember Al Sturpey on a future episode of the Capitol Press Room, when we'll talk with the Syracuse area Democrat about some of the efforts to update New York's alcohol laws, including where wine can be sold, as well as fees passed down to retailers.
Support for the Capitol Press Room is provided by New York State United Teachers, a statewide union of nearly 700,000 professionals in education and healthcare.